Welcome to Life Esteem, a program committed to deliver information that's important to you and your community. Your hosts are Nathaniel and Patricia Gadsden.
Good morning and welcome again to Life Esteem. Always great to have you as a viewer. Hey, today we have with us again our family doctor, Dr. Claudette Jatto, who's with she's the founder of Jatto Internal Medicine, and we're just so glad to have you on the show again.
Thanks again.
All right.
Appreciative of the opportunity. Thank you.
You know, it's amazing. You said your practice has now been open 3 years, I thought I heard you say.
It's been amazing too. It went quickly. We've had the first 3 years go by rather quickly, but we're so pleased that it has evolved into what it is now. So we're looking forward to more years in business, serving our community. Yeah. And it's been a good learning experience.
Well, you know, you say internal medicine and wellness.
Yes.
And sometimes I think the viewing population probably may not understand internal medicine.
Yes.
Because there are many disciplines. But tell us more about internal medicine.
Internists, we like to consider ourselves as physicians for adults. And that means anybody who's from the age of 16 all the way to 116. We feel that we've had enough training through our residency programs that have allowed us to be able to manage the very simple conditions as well as the complex ones that require hospitalization. So that allows us to become specialists of taking care of grown-ups. Right. So we're the doctors for grown-ups.
Doctors for grown-ups. Okay,
I like that.
I guess we're grown-ups then.
Yeah. That's pretty good. And so you have, I know, a special event coming up, an open house. Tell us a little bit about that. We
looked back for the 3 years, and like any new practice, you have a lot you're learning as you go. And we've been gracious and very opportune to have had patients that have grown with us. And we felt that for the first time we're old enough as well as prepared enough to give back. So we have an upcoming Patient Appreciation Day where we thought we'd open it up to the community and engage and participate and share and learn from them. And we thought that some of the things we would like to present, offer, would be things that would be beneficial to them as well as to us. And we thought that this would be the wonderful forum to achieve that in a Patient Appreciation Day.
Fantastic. That's great. And when is that, by the way?
It's coming up April the 4th, 2014. We have an open house from 1 o'clock in the afternoon till 4. And patients as well as loved ones and those who are curious enough to want to learn more should feel free to drop by and see not only what we're about, but what we feel makes us a little different.
Fantastic.
One of the things we had talked previously about is that looking at some exciting news, some things that you're going to be adding to the practice. Talk about some of those.
We feel we've done a very good job in messaging to the community that we're internists. We feel strongly about the integrative medicine that we practice. We strongly believe in traditional medicine, and we provide that, but we also feel that there's a lot that is additive when you think about the way you live, the way you eat, the way you keep active, and that's something that our practice feels very strongly about, and we try to message that. And for that reason, we've had a wellness center that we've created to add to what we do as internists, and we've been able to branch out. We've been able to involve, we've been able to partner with those in the community, and we do have a whole host of services we provide for which we would love to also share with the public regarding things we've been able to do, but things we've enjoyed providing to our community as well as patients.
Wonderful, yeah.
One of those I noticed is I got one of the flyers. I happened to be at your office just here in the last couple of days. And one of the things in regard to skincare and some form of facelift. Tell me.
Well, we're not dermatologists. I'm not an plastic surgeon, but we've discovered over the years that in the day-to-day visits, patients say, well, what do you think about this? And I'm considering that. We felt very excited about learning as well as sharing and providing skincare in-house. We've been able to do skin rejuvenation because that's what we feel is strongly the wave of the future. We know that maintenance is a wonderful culture. It allows you to not only age gracefully, but feel good about yourself. So part of what we want to do on our Wellness Day is share from our perspective what we've been able to offer, but also we've invited clients who've enjoyed our services to come in and enlighten our community as to what they've received from our practice, as well as what they feel has made us a little unique in providing that service to them. Yes.
One of the things I know that you're big on is preventive medicine, of
Yes.
course. And so let's talk about some of the common things that we can do
Yes.
before we get to you to really take better care of ourselves.
Yes.
I know exercise clearly is one of those.
Right.
What other
Right.
things would you prescribe?
Part of what we're going to try to do is think about this as a team effort. I don't know that it works if the physician has the autonomy of information, and I don't know that it works if we're not willing to listen to the perspective of the patients that come through the door. So part of what we want to do is present a few thoughts and ideas. One of them is how to manage yourself from your perspective if you do have issues that are chronic, so be it diabetes, be it cholesterol. But we also want to talk of primary care prevention. You don't need to have a medical condition to take your health seriously. It's your best investment. So we want to talk about partnering with your primary care physician, being able to come to the table, be aware of things you should have done at certain ages so that you're able to use that as a nice way to take good care of yourself. So I'm hopeful that this will be a good forum to impart that information to. Okay. Yes.
And you mentioned April the 4th.
Yes.
And where exactly is your office located?
It is 2205 Forest Hills Drive, Suite 12 in Harrisburg.
So if we're going down, what is that?
Lingelstown
Road.
Yes.
Okay, so you can find it.
We're in a complex suite of other offices, and fortunately we're right at the very front entrance, so it's not hard to find. And it's pretty easy. You could probably Google it too.
Yeah, that's right.
Yeah.
One of the things you said earlier, that internists are for grown-ups, okay?
Yes.
And as grown-ups, particularly when you get older grown-ups,
Yes.
right?
Yes.
There are conditions that tend to, unfortunately, come about with us.
Right.
And some of those are diabetes,
Yes.
we're noticing, especially with type 2.
Yes.
And some of the other chronic illnesses that come about. What can we do as we're growing older, okay, to maintain that in regard to a regimen or something?
Right. I think part of why we feel pretty good about being a small practice but an involved practice is that as we do get older, there are going to be more complex issues. And with more complex issues requires a time. We almost need that amount of time to be able to break down aspects of your lifestyle, your nutrition, the specialists that you probably see for various ailments, coordinating of care, and ensuring that there's follow-through on some of the things we discussed. So it does get a bit harder, especially as we get older, and there are a few things that we do have to keep mindful of. And experience has shown that sometimes the biggest issues are from communicating, understanding the information that's been presented to you by different physicians, being able to understand what prescriptions are for what, how to take them. And as an internist, we should really consider ourselves a jack of all trades. So we want to be that coordinator for you. It's almost like having your own family member as your physician who's able to sit down with you, make sure that you are being evaluated, but also coordinating care between various specialists who sometimes may also have to partake in the delivery of good care for you. And it does get a little overwhelming sometimes, and I see that in the eyes of patients. So it's your health, it's your understanding of your condition, it's your follow-through, and it's being able to break it down in such a simplified way that it allows you to feel like you're part of the decision-making process and not overwhelming.
That's one thing I do like about your practice. I mean, it is a conversation. You will challenge and you will listen.
Yeah, absolutely.
For senior citizens, you know, I heard once that once you get a certain age, you should change your diet.
Yes.
Because meat, for example, tends to stay on our track a lot longer and can cause all kinds of problems. Should we become vegetarians, or you know, how do we handle that? I know they say red meat's worse than the leaner meats and all that.
There are so many plans and nutritional advice, and we have so many specialists who are dietitians, nutritionists, lifestyle coaches, and I'm beginning to think that at this stage we have such an amazing amount of information. It still seems overwhelming. So what I've liked in what I'm doing is kind of stream it down. Work with what it is you like, what it is you know, and make the best options, health options you can. I'm not sure that we should ask of everyone to go vegan. I'm not sure if we should ask everybody to go to a plant-based diet, because I think that's a little unrealistic. But maybe the better goal would be to, how could you pick better choices amongst the things that you are willing to consider as your staples? And I think that that's a very, very realistic place to start from. It's more likely to be something you can follow through on. It's more likely something that you will at least make some achievable gains than if it's to be strict, you can have this but not that. I don't think that's sustainable for a lot of people.
Yeah.
And I think that's where a lot of the pitfalls happen, where people get very motivated, start with changes, but sometimes they fizzle out because there's a lot of restrictions placed. There will be people who will make that decision for themselves, and that's great. And we should partner with them if that's a choice that they're looking at, to say, here are some of the benefits, but here are some of the things you may need to add to if that's a choice you decide.
Okay.
Yeah.
Good, good.
And see, that's one of the things, too, I have to applaud and appreciate you in regard to having more of a holistic type of understanding and approach. And because, again, I guess it has to do with the individual as well.
It does. And I think that we should never jump in to assume we know better or what's best. I think that part of why internists clearly have defined themselves as doctors for adults is that we're talking to people who have their own capacity to reason things for themselves. I think that their interest is to learn, impart that information. They can make the meaningful decisions for themselves. And I would prefer not to jump and overstep that, but continue to guide and suggest and recommend as well as share. And if we can all understand our roles, I think that's when the team becomes efficient and effective. If it becomes a case of here's what I think you should do and not necessarily what I suggest, they may or may not consider that's in their best interest, and you may lose that ability to over time make change. So I'd rather focus on sharing and seeing how that continues to grow and evolve.
What's your take on the miracle drug aspirin? Okay, we'll talk about how aspirin is really something that we should consider as part of our routine. So, you know, a low dose aspirin.
I mean, it is clearly been shown, not only with studies, but a lot of data has been gathered that aspirin has been helpful in what we call primary prevention. That means those patients who may have somewhat of a risk towards cardiovascular events, but also secondary prevention, meaning you've had a cardiovascular event or a cerebrovascular event. I will say it is a medication. It is sometimes with its benefits and sometimes with its risk. So that's the sort of decision that I believe patients should ask their family doctors. Should I take an aspirin, even a low-dose aspirin? They may have some risk factors that may suggest otherwise. So even as simple as what is a great idea should be personalized. And I feel it's best to ask your physician, because at least they should know your other risk factors and match that with the potential benefit of the aspirin and hopefully arrive at a meaningful conclusion as to what's in your best interest.
Okay, okay, yeah.
You know, it's interesting you said that, because one of the things Nate and I sometimes are at home and they are introducing new medications.
Yes.
And in introducing those medications, they talk about all the side effects.
Yes.
And by the time they finish, you don't want to take that medication.
Right.
It's like,
wow.
Yeah, yeah.
So, but I guess there are, again, you said some health gains as well, health risk as well.
I think that the pharmaceutical industry has gone to direct patient marketing, and with that comes the responsibility of listing every side effect. Again, every side effect doesn't mean it's going to happen, but I think they're legally required to. And I think that's good in a way, because it allows you to take a step back to understand this is the benefit, but these are some things. But I think it should still be streamlined between the patient and their provider. If they were to get a recommendation to consider this medication, an informed adult should take the time to review what are the potential benefits, match that to some of the risk, and ask those questions that I consider due diligence. Is this something I should take? Why would I be taking this? What are my perceived benefits from taking this? What are the risks if it doesn't go well? And usually if it's made in a very straight, candid, simplified manner, people can make that decision as to why they take a prescription, be it new or something that's been tried before. So I think it's good that they share everything, but at the same time, it still does not indicate your particular risk. It's general information.
Okay.
Well, I'm pretty glad you explained that a little further, because I was like, I don't know if I ever want to take any of these things.
Yeah. And most people are, you know, we are afraid to take a lot of these medications, because then you don't just take one, you're taking a lot of them.
And there's a lot of concerns raised. And luckily, with a lot of changes in medicine, we have a lot of checks and balances. We have a lot of physicians, including my practice, that has electronic medical records. And we have in those systems pop-ups that let us know what are the mild, moderate, and severe risk with drugs that this individual patient is taking. The pharmacists are becoming a very good second place. They do sometimes pick up through their own systems potential drug-to-drug interactions, and they share that with physicians to give us an idea of things that maybe we did not necessarily pay attention to, or we may have overlooked, so that we can reduce those risks of drugs and drugs interacting wrongly. So some of the new technologies in place have been very helpful to physicians, I will say, in terms of allowing us to see what potential interactions can occur.
You know, people always say, well, to lose weight.
Yes.
There's an ideal weight and that kind of thing, you know. But that stuff has changed over the years. You hear one thing one day and another thing another day. But talk about the importance of excess weight on our systems.
What I've shared with patients in our wellness clinic is that we don't want this to be considered a fad, and it's not about focusing for the short term and then achieving a goal and then literally going back to whatever it was that maybe created some of the issues in the first place. There's a component of it that's mental, emotional, psychological. There's a component of it that is genetics. There's a component of this that's lifestyle. So it's a complex scenario, and no one plan fits everyone, and no one pill will fit every particular case. I think that in the perfect world, insurances will be able to understand that this is one of the biggest health issues we have and devote the resources to enable primary care providers to have the one-on-one. But I think in the real world, sometimes the time is not available, as well as the reimbursements from insurances, and that has discouraged physicians. We have not been discouraged by this, but we feel that there is an issue with weight. It sometimes could be an issue regarding health, but I would encourage people to bring this up with their physicians, do some research, put heads together, begin to figure out what's the best way to make a lifestyle change that may better suit the weight loss you're looking for. So I agree with you, Mr. Gadsden, that it is an issue. The question is, how do we solve it?
How do we solve it?
It's a little bit complex. It may not be the restriction of calories alone or the utilization of certain types of weight loss diets. It may be a combination of all things to sustain a lifestyle change.
I mean, you brought that, mine was Luther Vandross, how he had that yo-yo up and down, and eventually, you know.
So that's concerning. You know, you lose the weight, and then just when you feel like you've conquered that particular issue, sometimes the very issues that cause the weight gain were not addressed. And slowly but surely, things almost appear like they're coming right back to square one. And we've had many celebrities where we've been able to see, but we also have people in their personal lives who can share their story with you. Many adults have had times of success where they lost 20, 30 pounds and have gained it back. So there's got to be more to be said about how do we change the lifestyle, how do we maintain the loss, and what are the things to put in place in your personal life, health-wise, to ensure whatever you've lost, you can successfully keep it off. So I think the maintenance is becoming a bigger focus in my eyes than just the amount you lose. I think that that's where the success lies.
Yeah, and it's interesting you said that, because I know that particularly in our country, and some other countries as well, is we put a lot of emphasis on weight. And in a sense, sometimes it's unhealthy. In regard to the portrayal and to, you know, young women particularly feel that they in fact have to, be thin as a rail. And then we had anorexia and all these other bulimia and all these things started happening. And as you said, it's genetics, it's lifestyle, it's so many things. And how we able to share that message and having the appropriate, you know, family physician that to help people walk through that.
I agree. I think that if you've been opportune to live in different parts of the world, I will say that we do have a strong obsession in the United States with weight. And some of it could be a little bit to the extreme. And sometimes because of the unrealistic images that we may be exposed to, starting from a very early age, it could, you know, in fact, create body image issues. And sometimes it's sad to see that these can develop into health issues when it's taken to the extreme. I'm a strong believer, first of all, whether you're at a size 28 or a size 2, you have to self-love yourself. Second of all, it puts you in a better position to work with whatever goals you have. And then you do have to get to a point where you recognize, be it genetics, be it height, be it weight, that this is the optimal health that you're at. And it's not about the size you've become. And being okay with that, I feel, is very empowering, because it allows you to enjoy yourself in the moment and not constantly striving for unattainable goals or goals that you attain with a lot of consequences because of that pressure you've put on yourself. So if there's any message I want to get out there, is to self-love yourself. It is a work in progress for a lot of people, but more importantly, look at your weight as a part of a healthy lifestyle approach, and look at it as maybe a marathon and not a sprint.
Yes.
And not try to jump on every bandwagon of everything that's quick and fast, but think about things that ultimately will, in the long term, sustain whatever change you come across or you make.
So there are thousands, millions of people who suffer from insomnia. They don't sleep well.
Yes.
And they take all these medications and this and that, you know, we're sluggish. And at the same time, there's a sleep aid out there. Someone says, well, just take the sleep aid.
Yes.
Do you prescribe those? What do you think about those kind of things?
I mean, we do have fellow colleagues who specialize in sleep medicine. So without a doubt, we want to be very clear that there are conditions that are diagnosed as sleep disorders.
Okay.
And we have specialists who literally study the patterns of sleep to truly understand what the issue is, be it respiratory, be it a central issue or an obstructive issue. So we feel that when these patients take the proper assessments, it does allow the primary care provider to determine who has a sleep-related disorder. And not all sleep disorders may show up in what we expect to be I just don't sleep. A lot of people, however, have sleep hygiene issues, which is I've worked too hard, stayed up too late, there's a lot going on, the last meal of the day may be rather late. Those would be the people we would like to suggest before we say, here's a short-term fix. Can we take a look at your day-to-day sleep hygiene habits and change? I think a lot of sleep centers will talk about melatonin, so I know that's out there. And it's not a sleep pill, but it's to encourage your sleep center to activate itself. And there are a lot of healthy options that a lot of sleep centers would like to put in place before a prescription is given, because as well as they work, there could be some perceived issues and consequences. And I think there's been a lot of recent information out there regarding some of the changes being made by the FDA regarding certain sleep pills and the use in certain genders, men versus women. So this is important data that's out there patients can check up on.
Okay.
Yeah.
You know, I had one of our members of our church said to me on this past Sunday, said I went online to do the insurance under President Obama's, you know, what is it called, affordable health care. I don't want to say
affordable
health care. That's what it is.
Yes.
And she said she's really glad it's there, and she's glad she said, but it was a long process.
Right.
She said it took about 2 hours.
Yes.
I said, what? I was shocked to hear that, you know. So what are you hearing as people are coming into your office and, you know, other doctors are saying in terms of, I understand more and more people have registered, and it's a good thing.
Yes.
But, wow, 2 hours could be discouraging.
From my perspective as an internist, we've discovered there's been a little bit of a deficit regarding information out there, regarding what this program is all about. And funny enough, providers, utilizers, we're all trying to understand it. So it's truly an evolving conversation. I forgot to mention it, but we are actually inviting somebody from out of town who's coming to our open house, who's going to give a little presentation on the Affordable Care Act and the Pennsylvania Health Exchange. And this individual is actually helpful to the state in terms of creating our own Pennsylvania Health Exchange. And I thought the least we can do was to take away the stereotypes and the dogma and sort of just put it at a very simplified level as to what is it we need to know, both as providers, but more importantly as utilizers, patients. So I'm hopeful that we can have a spirited conversation regarding that. But I agree with you, there's a lot to understand, and we feel like it's here, and we all want to make sure that we get the best out of what it is that is coming our way. So I thought that that would be something that we should all share with those who are able to come over, and that is part of what we're going to be presenting too, because it's part of the healthcare.
Okay, wonderful. We need to remind our viewers also that your open house is April the 4th.
Yes.
And the time again is?
It's 1 o'clock to 4 o'clock.
1 o'clock to 4.
And we do want to give out a raffle draw for those who are interested in skincare and aesthetics, and we thought that would be an excitement. We're going to do screenings for those who've not been able to have health care as of yet to provide for their general laboratory data. We thought that would be a nice give back. So we're hoping those would be nice things that will allow people to feel like they got something out of showing up.
Great.
Yeah.
Great.
And one of the things, too, outside of medicine, we had a brief conversation about the most recent Oscar awards, and for our wonderful Lupita
Nyong'o.
Nyong'o. And how really wonderful, because she's from Kenya, and you're from?
I'm from Nigeria.
Nigeria, okay, originally. And the thing about Nigeria, I just found something out, and it's something we were going to share on Sunday. But of all the countries in the world, Nigeria has the most largest black population.
True.
And I thought that was interesting to hear
True.
in that regard.
True. I'm very proud of that heritage. I was born here, but definitely raised in Nigeria. And I think that has molded me in my perspectives on a lot of things, but it also makes us equally appreciative of the healthcare we're able to provide here. It's a country with the largest black population, but we have a high level of well-accomplished professionals. And yes, I feel proud about the fact that she won the Oscar. But more in general, I think I feel proud of everyone who's making an effort in life, regardless of ethnicity, background, creed, race, to ask of themselves what it is they have as dreams and go out there and pursue them, because I don't believe that there's any barriers. So if anything, the take-home message is not so much of her African background, but it's an example of what you can do when you set your mind to something that you strongly believe in. So that's the take-home for me.
That's kind of what you were saying as well. That's amazing. Are there many female internists, doctors in the area here?
We do. We do have a few female internists. I will say maybe there are less female internists who have small individualized practices that I do have, but we have a few internists in our community. So Harrisburg is a nice area where we have a lot of practices, a lot of options, but we feel pretty good with the niche we've created for ourselves.
And you don't have problems with men coming to you?
No, please.
No. We have you.
This is not an all-female patient-based practice. We actually have an even split, and there are men as well as women, teenagers, elderly. They found this to be what they're looking for. So by all means, this is not a female-based practice. I'm a female provider. It does give me an edge, but at the same time, we've had male patients who felt just as comfortable with having their care, and I don't believe that people, once they get comfortable with their doctors, see them as men or women. They say, that's my physician.
That's right.
And that's a true sign of a physician who's doing what they need to do.
Amen. That's very true. Very true. Right. So and I know we're quickly running out of time, so how can people contact you if they're just interested in knowing more about what you do?
We have on our website, www.jattointernalmed.com, some information about our upcoming event. It also gives us a little bit of a synopsis about what we're about, our mission statement. Of course, we love phone calls. We are able to answer concerns you have, and we have our email, and that's all on our website. So you can check that out, and phone numbers, emails, faxes, that's all available there to be able to communicate with us.
So just go to Jatto Internal Medicine.com on the website.
That's right.
And you'll get it. Well, thank you so much for watching this program. As always, we try to bring you great information and great people in our community, and Dr. Jatto is certainly one of those persons fitting that bill. And we know you